Safe staffing is all about having enough nurses on duty to deliver care safely. It seems totally obvious that having enough nurses is going to make a difference to the quality of care. But actually, up until a few years ago, we have no limits on how many patients a nurse in hospital looks after. This obviously puts patients at risk because some places have much lower staffing levels than others, and that's what some of our research found, that there's huge variation in how many nurses are actually present. And what's been important then is that our research has helped to show why it matters.
As a nurse, I see every day how staffing affects the care that we're able to give as nurses to patients. Obviously, patient safety is always our priority, but it's also our bare minimum. We want to go beyond just keeping patients safe. We want to be able to deliver a high quality level of care as well.
Patient safety and health workforce safety are inseparably connected. They are two sides of the same coin. You cannot keep patients safe without prioritising the support and the protection of nurses and the health workforce. And that message has made a real impact globally this year, because it is going to be at the heart of this year's Global Patient Safety Day. World Patient Safety Day on the 17th of September will be focusing on health workforce safety to demonstrate the interconnectedness, the interrelationship, the inseparability of patient safety and health workforce safety. And in part that is possible because of the solid, credible, overwhelming evidence that we have to demonstrate the relationship between nurse staffing levels and patient safety.
This is a critically important intervention, and with other critically important interventions, maybe a type of surgery or a particular drug, you would want to make sure you get it right. In the same way with other interventions, if it was a new drug that happened to be cheaper, we would not allow hospitals to just use that drug without seeing what the impact is going to be on patients carefully. And yet, when it comes to nurse staffing, we have allowed this intervention to be done in a way that doesn't necessarily protect patients. So we've allowed patients to be exposed to harmful low levels of staffing. And that's why it's been so important to make that harm and that risk much more apparent.
What Ireland has done, it has taken research and implemented that research into clinical settings and measured the impact of that research. In a number of wards, adjustments to staffing were made, and we identified a number of outcomes. These included that adverse events associated with nurse-sensitive outcomes reduced following the changes in staffing. We also saw incidents of missed and delayed care reduced over periods of time. And in those wards where adjustments were made and the pilot framework was introduced, we also saw that there was an increase in levels of job satisfaction, a reduction in staff intention to leave. We know the World Health Organization has said that there's a shortage of 6 million nurses globally, and there are going to be challenges in the recruitment and retention of the nursing workforce.
What do you need to be able to get more nurses? What you need is partly to be making sure you're providing conditions that allow nurses to give good care to patients. Conversely, if you provide nurses a situation in which they're not able to look after their patients properly, they're having to leave things undone, it wears away a person's feeling about their job. It drags someone down. We end up with burnt out nurses who feel very stressed by their work and who end up leaving.
As an evidence-based profession, we need our patient safety also to be evidence-based. So it's really important that there are people doing this research at Southampton. For me, safe staffing is not only about patient safety, it's also about staff well-being as well. At the end of the day, we're only human. We have limits as well, physically, emotionally, mentally, and we can burn out, which is obviously not great for us or great for our patients either.
To get more nurses actually requires us to have nurses in place, because too few nurses means it's not a good place to work.
ICN is an organisation of 130 national nursing associations and the voice of 27 million nurses worldwide. ICN know that safe staffing is an absolute priority for the overwhelming majority of our national nursing associations. And for that reason, it's a strategic priority for us.
We've generated research data that shows how important it is, why it's important, that shows that when there's not enough nurses, care gets left undone. When care gets missed, patients end up dying. Patients that shouldn't have died. Patients that, due to their illness, were predicted not to die, have ended up dying unnecessarily. And that's actually changed the way people think about nursing and nurse staffing and has led to different policies and guidance being created.
What this research has done in Ireland, it has embedded a safe nurse staffing framework within the healthcare system. And it's very much a priority at both governmental and health service executive level. The research also made a number of recommendations regarding the structures that should be in place. So, for example, a number of hospitals now have in place safe nurse staffing coordinators. At a national level, the health service executive also has put in place a national safe staffing coordinator who can monitor and advise the various hospitals on the safe nurse staffing framework. What we have done is we have applied the recommendations and the outcomes from that research to develop a framework for safe nurse staffing.
Now we can see what the harm is. It puts the onus on policymakers, not just in the UK, but actually around the world, to use that evidence. Once you know that something is harmful potentially to patients, harmful to the people that are in your care, it becomes negligent not to use that evidence to make sure that you do the right thing. So it's really vitally important that we haven't just generated that evidence, but it gets used. It gets used to change practice and to change policy.